Hello and welcome to HSM 430. For today's class, we will be discussing wellness and patient-centered care. So there are three objectives. First is to define what wellness is and what patient-centered care is, to compare disease prevention to health promotion, and then finally describing different forms of health records and the principles behind their use in healthcare. So, starting with wellness and patient centered care. What is wellness? So, the principle of wellness is that there needs to be a holistic approach to health, meaning we are not to focus only on the physical health, which is the one that most people are very familiar with, and there's been a lot of attention that has been paid to it. It also involves a conscious and deliberate process of making choices to improve your health, and in order to maintain or even achieve optimal health, you need to pay a lot of attention to all aspects of health, and for example, not focus only on the physical health, which, as I said, is the one that most people are very familiar with. So, wellness also does call for healthcare professionals to recognize that their roles and responsibilities includes extending healthcare beyond just healing patients, but also they need to incorporate all levels and dimensions of health in their interactions with patients. So, and also in so doing, be mindful that one component of wellness it's not more important than other components, and therefore should not be treated as the central focus while neglecting all other components of health. And it's very, very important to understand for everybody, both patients and healthcare provider, that wellness is not a destination. It is a lifelong process. It's something we all have to work towards achieving, and some days are going to be easier to achieve than others, and some people are going to be better equipped to achieve wellness than others. So, what are some of the assumptions that are made in thinking about wellness? The first is that individuals must be able to self assess their own wellness needs, need to be able to act towards those self assessments and trying to meet the needs that they have identified. They also needs to be able to evaluate the progress that they are making towards achieving those wellness needs, and understanding that wellness is not a destination, like I said, but a lifelong process, and therefore they need to continually work towards that. It's also learning how to move from a lower level of wellness into a higher level of wellness when you have identified maybe a deficiency that you may have in a dimension of wellness. And also having the means to meet wellness goals. Everybody doesn't have the same equal opportunity to meet wellness goals. Some people have more of it and some people have less of it, and being able to be realistic about what you can achieve. Having peer support is one of the things that is very, very critical to work towards achieving wellness. So it's another thing to consider. So these are the dimensions of wellness. There are 8 of them. You have occupational wellness, you have environmental wellness, and also physical wellness. So there are 8 of them. So it's important that one recognizes that there is all us as human beings have a multidimensional nature to us, and therefore a multidimensional relationship to health. Because of all these different dimensions of health, of wellness, the way that we as human beings interact with these dimensions also means that we have this multidimensional relationship to health. And this comes very much with recognizing what the social determinants of health is. Now, if you have taken HSM 220, this will not be the first time you're hearing about social determinants of health. But just in case it is a concept you are unfamiliar with, I have provided a link to the video, a YouTube video that is a short video that talks about what social determinants of health is. But by definition, social determinants of health is described as a condition in which, in the environment where people are born, they live, they learn, they work, they play, they worship, they age. So this may all sound like a bunch of words to you that don't mean anything, but a way to kind of explain it is that where you were born, or who you were born to, or the family you were born to has a lot of influence on the kind of health, the state of health that you have. People who are born in wealthy families are more likely going to have good health outcomes than people who were born in abject poverty, for example. So that is a way of understanding one's health, that is not just about what you do to achieve health. There are a couple of things that are already at play that may put you at an advantage or at a disadvantage of being in good health. So let's discuss those dimensions of health, wellness, and we're starting with intellectual wellness. This means, being able to develop problem solving skills and being creative and, having abilities to learn. And it also includes being able to seek ways to expand your level of knowledge and your skills in order to its full potential. Then with emotional wellness, we are looking at one, being aware of your feelings and being able to accept those feelings. It also means being able to control or cope with both your own feelings and the feelings of others, and having to do it in such a way that you're not having harmful behaviors that are only going to compromise your wellness. Then for physical wellness, we're looking just beyond not having diseases. It also means being able to appreciate the relationship between engaging in healthy behaviors and the way your body functions. Being understanding that if you eat healthy, you're likely going to have be in good health, and if you eat poorly, you're likely going to be in poor health. It's just being able to appreciate that relationship that your body has with your health behaviors. And a good physical wellness does increase your potential to resist illness or not be at risk of getting illness, or in situations where you do get the illness, you're able to recover quickly. Occupational wellness looks at finding fulfillment in the way that you're contributing your unique skills, your gifts and talents to where you're working, and also finding purpose through work. So one of the things I don't quite like about capitalism is the way it pushes for work, in the sense of making money to be able to pay bills without paying a lot of attention in job fulfillment. For you to have good occupational wellness, it's not just that you have a job, but that the job gives you some form of fulfillment, and you can take some form of happiness or good feelings from the job. If you have a job that pays you money, a lot of money, but you feel dead inside as a result of the job, you are not having occupational wellness. So it's something to pay attention to. Spiritual wellness, I just want to first of all say, spiritual wellness is not tied to religion. It's mainly a sense of believing that you have a meaning purpose in your existence. It doesn't have to be you having any form of religion for you to have spiritual wellness, but also a sense of your internal world and your external world being in harmony. And you might get that through performing volunteer services, for example, or even having pets that you love, and you put a lot of your time and efforts in. So there are many ways of achieving spiritual wellness that is not tied to religion. It also does encompass the values, the beliefs, and the actions that you take, and then being consistent with those feelings and purpose of human existence that you have. Financial wellness is about having sufficient resources and being able to manage them effectively. So even though it says financial wellness, it doesn't mean that all wellness under financial wellness is monetary. It goes beyond that. Sometimes your ability to have resources is non-money related. If you have a community of people whereby if you need help, let's use for example, you have a child and and your child is sick, but you have to go to work, being able to have somebody that you can leave your child with and so that you can go to work is a form of financial wellness, because in its absence you will have to stay back from work and not get paid. So those are all the things that contribute to financial wellness, and also being able to meet your needs and achieving your goals, and also being able to effectively access healthcare and afford healthcare, which is something that the US is not doing very well in. The US healthcare system does have a big problem when it comes to affordability and accessibility of healthcare. And then we have social wellness, being able to have good communication skills and having the capacity to be intimate with people from a social point of view. Also being able to accept individual collective differences. We are not all going to behave in the same way or think the same way, but being able to have that kind of accommodations that people are going to be different all plays into social wellness. And also cultivating supportive social networks, something that is very, very critical with social wellness. Environmental wellness is very much, as you can guess, all about preserving the world, preserving nature, and all knowing that we all have roles that we can play towards preserving the environment, because if something goes wrong with the environment, it's going to affect both those who believe in climate change and those who don't believe in climate change, but in understanding that we are all playing roles towards preserving the environment and understanding the connectivity between nature and one's individual. So that said, let's talk about patient-centered care. So the idea behind patient-centered care is that it is the kind of care that relies on effective communication and empathy. We talked about this in module 1, where we talked about sympathy, empathy, and compassion. So patient-centered care requires that healthcare providers do have empathy in their interaction with patients, and having a feeling of partnership that they have between themselves and with the service users or the patients in this case. And from the patient's point of view, patient-centered care means that healthcare providers are valuing pay a lot of attention to the value, preferences, and goals that patients have, and work towards integrating those when they are making clinical decisions, and also recognizes that the patient view, their input is all very helpful towards the patient achieving their overall health outcome. So we can't say we are doing patient-centered care when we as healthcare professionals just talk at patients. So patient-centered care is healthcare service that is not done to the patient, but healthcare service that is done with the patient. So patient-centered care does help in empowering patients to take charge of their own health rather than them becoming passive recipients of the healthcare services. It also requires healthcare professionals to listen to patients and to make sure that they are informing and consulting patients throughout the healthcare continuum, and having them consider the patient's preferences and values that when they're making clinical decisions. So Patient-centered care is built on a couple of principles. The first is to respect patient values, preferences, and needs that they have expressed. Um, that there is coordination of care and there's integration of care. This is something that is very, very important and key with interprofessional collaborative practice. And that there is sufficient information, communication, and patient education that is being built toward into the continuum of care and in delivering health services to patients. That there's a lot of attention that is paid towards the physical comforts of patients, and healthcare professionals are open to provide emotional support and to help alleviate the fears and anxiety of patients. But this doesn't mean going against the ethical principle of veracity, whereby you end up lying to patients just to help them alleviate their fears or anxiety. That's not in line with the principles of patient-centered care. Also, you need to involve families and friends in the care of a patient. And of course, patient-centered care is very much focused on continuity of care, but also in transition. You don't want to move one patient from one healthcare provider to another healthcare provider or another health specialty without adequately guiding the patient. You don't want them, just for example, having to, after seeing the primary care physician and knowing they need to see a dietitian, and they don't know what next to do after seeing the physician, because there hasn't been a good transition to help the patient move from one specialty to another. So patient-centered care has to pay attention to all of this. And of course, access to care is very, very key to patient-centered care. There's some clinics that I have visited, I've taken care from, that provide transportation to patients, and the reason because it understands that patients that do not have transportation to get to the clinics will be having their access to care denied. So those are some of the things one thinks about when providing patient-centered care. So now let's get to disease prevention and health promotion. So quickly talking about disease prevention. So with disease prevention, we are kind of focused on reducing the impact of disease and its associated risk. So it's really all about focus on the disease. Like if you don't have the disease, trying to prevent you from having the disease, or if you have the disease, trying to cure you from having the disease, or you can't be cured, trying to make it easier for you to live with the disease or to die with dignity with the disease. That is all part of disease prevention. So there are a couple of aspects of disease prevention. We have the primordial disease prevention. This focuses on the removal and mitigation of social determinants of health. Then we have primary prevention. This kind of works on preventing the onset of specific diseases. An example would be vaccination would be a type of primary prevention, because you're trying to prevent people from getting a particular infection by vaccinating them. Social determinants with the primordial prevention could be in trying to educate people about vaccination, whereby they become more in tuned into or more open towards getting the vaccination. Secondary prevention will be detecting the diseases and being able to manage its control, just like we have the breast cancer screening. That is an example of secondary prevention. And then tertiary prevention will be, let's say you have the breast cancer and you're trying to reverse it, or trying to get it to a point whereby it doesn't have a huge effect on one's health as a result. So it's kind of mitigating the effects of the disease. And then we have the quaternary prevention. I'm sorry for that. So what that does is it tries to look for treatments that can replace old treatments, that in such a way that the new treatment is going to have milder or fewer side effects, as a way to help patients survive it longer, or it have less disastrous effects on their health even when they recover from the disease. On the other hand, health promotion focuses on increasing the health resources rather than remedying an existing health problem. So, an example would be trying to empower people to increase control over their health, and they do this by promoting the social determinants of health, and they could do this through health literacy efforts or intersectional actions to help increase healthy behavior. Now, you might wonder, so what is the difference between health promotion? Because we talked about social determinants of health in the primordial prevention, and now we're talking about social determinants of health in health promotion. So what is the difference between these two? So in the health promotion, where we're doing with social determinants of health is, with primordial prevention is more or less like trying to identify, say, okay, these are all the things that play a role in your health, and we're trying to address those. This health prevention actually goes into the work of preventing those by teaching the people about it, giving them a much in-depth education about the social determinants of health, and working with different agencies towards trying to remove those. So let's use, for example, someone who lives in a high crime community and there's heavy policing that is happening in that community. Health promotion would be working with the police departments, or working with the EPA, or working with the food industries or food companies to try to make things easier for the people that live within that community, so that they are able to eat healthy and they are able to safely go to school and stuff like that. That would be the domain of health promotion. That is not how disease prevention functions. So health promotion also includes trying to improve self-efficacy skill in taking control over their health. So self-efficacy, in this case, I have included a YouTube video to explain it, but self-efficacy is kind of talking about one having confidence in their ability to make decisions that are good for their health. Let's use, for example, you decide that I want to eat healthy, and you have the confidence that I can plan out meals that are going to be healthy for me, and I'm going to eat these meals that I'm planning out, and I'm not going to eat unhealthy food. So that is a confidence, that is a self-efficacy that comes into it. So health promotion does help to increase people's self-efficacy, but also it goes a step further. If you live in a place called food desert, self-promotion works towards trying to get healthy food close to you, so that it's easy for you to actually take control of your eating habits and be able to eat properly. Because just having that confidence that I'm going to eat well, meanwhile there are no healthy food around you, soon enough you're going to lose that confidence. So health promotion doesn't just help you have those confidence, it does help to solve the social infrastructures that makes it easier for you to be able to take those decisions that you need to take. So there are a couple of health promotion interventions that happened along patient-centered care. It does by empowering people to take charge of their own health, rather than them being passive recipients of health, by building patients' confidence in themselves and being able to make health decisions that are good for them. That is all part of the interventions that health promotion does do. And also getting healthcare providers to pay attention to listening to patients, to informing patients of important information, consulting patients throughout the healthcare continuum. Also helping healthcare providers to consider patients' individual preferences, their needs, their values when they are making clinical decisions. I have talked a lot about patients' preferences, patient values in this class, and that's because it is very much at the core of patient-centered care, and something that we need to, get really sit into our heads so that we don't forget that at the end of the day, patients' values, preferences, these are very important things that we cannot afford to neglect. So finally, we are going to talk about health records. So what are health records? They consist of all the information that are gathered from patients throughout the whole clinical setting. It comes from the inpatient intake, the first time that you're encountering a health provider, a health setting, all of those forms that they make you fill is all part of health record. And also, when you're signing all of those papers that you're signing, all of them are all parts of your health records from the first start your interaction with the health facility till even when you're interacting with insurance companies. All of these are all parts of your health record. So as a healthcare provider, by failing to properly document a patient's interaction with a health facility, this could result in being fined, or even as far as having your license being lost or being revoked, or even being evaluated. So paper and charts used to be the way that we did patients' health records in the past, but now we've kind of mostly transitioned towards electronic health records and electronic medical records. If you have taken HSM 215 or HSM 215, you would be familiar with what these two means, but I have included information on those just in case you're new to it, or you need a refresher on what those mean. So health records also include legal forms, and if you guys would remember, whenever you go to see a doctor, they have you sign this paper that says that you're consenting to treatment, and also to have your information sent out, and stuff. So those are all legal forms. In a case where there is a dispute, medical dispute, those can be called into question. And for those, so also, if you're not familiar with what protected health information is, I have also included a short YouTube video to kind of guide you towards that. So in case you're wondering what a protected health information is. So another key thing when it comes to health records is informed consent. With informed consent, the idea is that you're making sure that the patient fully understands the treatments that they're going to get, so that there is nothing that is being hidden from them. If there's going to be side effects to the treatment, they need to be aware of it. If there are alternative to the treatment, they also need to be aware of it. And if they make decisions to go with those alternative treatments, it also has to be documented that I did all of this. So that's basically what informed consent means. So it needs to be signed by the patient, agreeing to be treated by the provider. So now brings us to the question: can consent be implied? The answer is yes. There are instances in which you might accept an implied consent. Let's use, for example, you go to a clinic and you're asked to weigh, and the nurses tell you, if you could please step on the scale. When you step on the scale, that is an implied consent. But does this mean that implied consent works in all situations? No, because you could get into trouble when you have mostly operated on implied consent. You could have a patient turn around and say, I never gave consent for that, and you could get into legal problems for that. So you can do implied consents, but just be aware that there are a lot of risk about that. So if you do not consent to a treatment, and the healthcare provider goes ahead and gives you that treatment, they can be charged with battery. And what happens is that when patients have been physically harmed or injured or developed a illness because of provider intervention, or they feel violated by the provider. Maybe they did not consent to being touched by the provider. That could lead to the charge of being battery. And a patient can sue for battery if the patient refused consent to a treatment and they got the treatment regardless. And this is where the implied consent thing gets a little bit tricky, because if you don't have record that the patient consented to a treatment, and the consent was only implied, and the patient turns around and say, I never consented to this, you don't have any documents to back up why you did the treatment regardless. So you could get into trouble, legal trouble for that. So that is one of the reasons why implied consent is kind of something dicey, and that should be avoided as much as possible. And then another medical record we have is what is called Notes to Privacy Practice, NPP. What that is how a healthcare organization may disclose or use your protected health information, whether it is with your authorization or without your authorization. It also covers patients' rights to their privacy, and covers an organization's responsibility to safeguard their protected health information. So it includes details of the organization's policy on privacy, and NPPs need to be clearly written in ways that is not going to be full of jargon, whereby it's difficult for a patient to understand what is written in there. And then we have what is called ownership. So what happens with healthcare is that when it comes to paper records, the physical paper belongs to the organization, even though the information in it belongs to the patient. Meaning the patient cannot say, because this information is about me and belongs to me, I can take the paper out of a facility. They can't do that, because the paper itself belongs to the organization. So they have ownership of the paper. So, but a patient can request changes to be made to the information that they have in their record, and that will be, they have the right to make those changes to their records. And but the organization owns the medium by which the patient is being done. For example, you have the My Charts. This is more or less like the patients are being offered the ability to use the app, but the app does not belong to them. The information in the app does, but not the app itself. So this is kind of trying to understand how ownership works. So data is owned by the patient. The health data is owned by the patient. However, the storage and maintenance of the data, including securing the data so that you don't have protected health information being leaked out in the public, that is the facility's responsibility. And then we have release of information, ROI. So nobody should have access to a patient's personal protected health information unless the patient allows it. This means that even if you are concerned about, let's say, your mother's health care, you are not going to go to the doctor and ring the doctor up and say, what is wrong with my mother? That sort of, the doctor does not have the right to release that information to you unless the mother said, it's fine, you can tell my daughter this sort of information. So that is what that is. So a patient must sign this ROI to authorize the disclosure of their health information to others. But even if you as a patient, you need to see your own record, you may be required to give consent to that. So all signed ROIs are kept in the patient's health record. So that's where we end for today's class. Please remember to use the Q&A boards to ask any questions you may have, and I would answer it. Do have a lovely day. Bye.